Howdy everybody, this is Doc with Thorofan. Happy holidays to all, and of course one of the big things that has been in the news recently in regards to thoroughbred racing has been a lot of the medication regulations and medication changes that has been going on, most notably out in California, but it's certainly in some other areas as well, as the industry pretty much tries to get away from any kind of race day medication, and especially longer withdrawal times for certain medications that are already allowed. And two of the medications that have come up recently, I think is something that we should discuss a little bit. They both start with B's, and we're going to kind of go through how both work and why they're both important and why, of course, they're so focused on right now in the thoroughbred industry. So let's go ahead and discuss Bute and Bisphosphonates.
Okay, so Bute, or as it is more scientifically known, phenylbutazone, is what is known as a non-steroidal anti-inflammatory drug, or NSAID. Most commonly, it is prescribed and used in horses to both reduce inflammation and pain in injured areas. It is sometimes also used as a drug to try and reduce a fever in a horse, but that is not quite as common. To understand how Bute works, we first need to take a quick little tutorial in what happens in inflammation. Anytime you, me, a horse, a dog, or any creature suffers an injury or infection, there is what is known as an inflammatory response at that site. Basically, it's a simple cascade of events that looks like this.
Everybody getting this so far?
Easy, right? No? Okay, let's see if we can make it a little simpler. Basically, what we are focusing on when it comes to NSAIDs is something called COX. Just know that in order to stop the inflammatory cascade, we need to block what are known as COX enzymes that help produce things further down the line. As you can see here, Bute works by blocking both COX-1 and COX-2 enzymes and thus prevents inflammation. Inflammation brings with it heat, swelling, and oftentimes pain. All of these are mechanisms to both promote healing and to prevent us or an animal from doing further damage to an area while it heals. Blocking this process can be beneficial to most beings. You take Advil or aspirin for a minor ache or sprain, for example. Healing will still happen in the presence of an NSAID. However, the healing will go on with less pain at the site of the injury. Inflammation can be acute, happening suddenly, or more chronic and long-lasting. Think arthritis pain in you or me. NSAIDs can help both of these conditions. So, if an NSAID is so helpful, why is there so much talk about increasing the amount of time when a horse can have it before racing or even working out? Well, remember that an NSAID on board will decrease pain and inflammation. What is one way that a horse that might have an acute or chronic inflammation show it?
Bingo.
That's right, lameness. One of the biggest things racetrack and state commission veterinarians look for in their pre-race exams is evidence of lameness or pain when trotting and walking. They also look for it when the horse is warming up on the track. Well, block the inflammation and you block the signs of injury and pain. But wouldn't a horse prefer to run pain-free, you ask? Ah, not so, my young Padawan learners. For the data and science tells us the most common place horses have both chronic and acute inflammation is in their fetlocks, or what we sometimes refer to as the ankles. As we've discussed in previous segments, a breakdown of the fetlock apparatus can be absolutely catastrophic and life-threatening for the horse. If you or I were to take Advil before a big sports outing, and because the pain was reduced in our ankle or knee, we overextended ourselves, a sprain or even a break could occur, but we would be okay with time and treatment. Not necessarily for our horse friends. If Bute given to a horse makes it so vets cannot detect there is an injury or inflammation in the area, the horse appears as if he or she is sound. As such, the vets permit them to race. Since the horse cannot feel the pain from the inflammation that is being reduced, they too might go further a lot of times than their body normally would allow if no NSAID was on board. And that can lead to the joint failing and catastrophic breakdowns. Sure, this is all a fine theory and all, but many would ask, is there any scientific proof to back this up, Doc? Well, for the longest time we did not have any, just what some equine vets had tracked on their own. Then, finally, a study soon to be published in later 2020 in the Journal of the American Veterinary Medical Association showed for the first time a statistically significant correlation between horses that had catastrophic breakdowns while also having evidence of Bute in their systems. Now, I will say the study was done on horses running in South America, where Bute is allowed on race day and is not nearly as controlled as it is here in the US and other countries. But regardless, it does show that in order to get a true example of how the horse is doing and feeling prior to a race, the Bute levels need to likely be 0 for the track vets to get an accurate picture of the horse. Again, this is not to say Bute needs to be forever banned as a treatment for issues in horses. It is an incredibly effective drug and is still used daily for all sorts of issues a horse can come down with. However, for the purposes of being fit and healthy to race, it appears the science is telling us that we as an industry really need to start looking at making sure no Bute is present in a horse's system at the time of racing or strenuous workouts. So, since today's discussion topics are brought to you by the letter B, let us move on to the other drug getting a lot of attention of late in the racing world, bisphosphonates. Compared to Bute, bisphosphonates are a relative newcomer to the world of equine medicine. They are basically approved for one purpose, and that is the treatment of navicular disease or navicular syndrome in horses over the age of 4. Describing navicular disease or syndrome would be a whole discussion topic in itself, but basically it is a degenerative condition of the navicular bone, seen here pointed out by the arrow. That degeneration can be caused by many things, and the whole syndrome is not really well understood as of yet. What is known is that there appears to be an imbalance in the remodeling process of the navicular bone. Remodeling of bone happens in all species and is necessary to help strengthen bone that is under repeated stress of training or racing. Remodeling also happens in the case of fracture repair, something we'll address in a minute or so in relation to these drugs. In order for remodeling to properly occur, a certain percentage of bone must first be broken down by cells known as osteoclasts, these cute little red guys you see in this video. They actually secrete an acidic substance that dissolves some of the bone matrix. After that is done, bone-forming cells, called osteoblasts, the cute little blue guys here, come in and help lay down new bone to make the remodeling complete. This happens every second of every day in horses, and of course is more of an active process as horses grow and mature. So what does all of this have to do with bisphosphonates? Well, the drug works to block the action of those osteoclasts, preventing resorption of bone. In the case of navicular disease, this is thought to help prevent over-resorption of the navicular bone and thus help the condition. There is also thought to be some possible pain-killing effects of the drug, but exactly how bisphosphonates help in this condition is still not 100% understood. The studies have just shown, time and time again, that they work. So why all the concern in the racing industry? Well, as is often the case with a lot of drugs used in veterinary medicine, bisphosphonates are being used in what we call an off-label way. This is not uncommon, and in fact some cases is necessary when no other drug is available to treat a condition. However, what is being alleged is that the reason some were using bisphosphonates was not for a medical condition at all, but rather to make their horses' bones look better on radiographs that are viewed at sales pavilions by prospective buyers. By blocking the resorption aspect of bone remodeling, bones could look stronger on radiographs, a sign used by some to judge soundness and toughness for racing. Here's the problem, though. Because no one knows exactly how long bisphosphonates stay active in a horse and how long the blocking of osteoclastic activity continues after administration, when a horse begins to undergo more strenuous training, that normal remodeling process that goes on to strengthen their bones is hampered, and actually could make their bones more brittle in the process. This whole issue was first noticed by a few prominent equine surgeons in the field who were noticing that the fractures they repaired were not healing the way they normally should, and the fracture repair process on the cellular level appeared to be hampered. As a result, the fractures actually could not properly heal down, and the horse could not be cleared for further racing or training. This was seen in something as simple, well, at least by today's standards, as a mild condylar fracture that might require 1 or 2 screws to easily repair. When these surgeons started looking at the horse's medical history, it was found the horses were given bisphosphonates at some point in their lives. That kind of sounded the alarm. So why the concern in the racing world with it then? Well, part of it is an ethical and moral responsibility some feel certain breeders and sellers have been ignoring to try and make their horses look the best they can at the sales and fetch a higher price by giving these drugs. The other is that since we don't really completely understand them, there is a concern that their usage could lead to more fragile bones in a horse that are then more prone to breakdown. There are a lot of rumors out there right now that the reason we are seeing these spikes and breakdowns all of a sudden around the country is because the horses that are suffering these injuries were treated with the drug at some point in their life. Unfortunately, there is no real reliable test that can show evidence of bisphosphonate administration that happened more than 1 month prior. Research is currently being looked at to identify better tests. Some of the major sales companies have stepped up and said that any horse a potential buyer wants tested for the substance can have it done, and anyone found to administer the drugs to a horse going through the sales ring as a juvenile will be dealt with harshly. Time will tell if that holds up. In the meantime, though, many jurisdictions are now passing regulations with a zero-tolerance policy for bisphosphonates usage and barring any horse that has been treated with the drug for racing for at least a year. It is a start, but since we still don't know everything about the drug or detecting it, we can only hope that what we have seen is not the tip of an iceberg the racing industry is about to go crashing headlong into.
So I really hope that does kind of explain things a little bit in a way that is easier for people to understand when it comes to both bisphosphonates and Bute. They are certainly very, very important drugs when it comes to thoroughbred racing, and for a lot of different reasons. And it is actually going to be a very good thing with a lot of the changes that are now kind of coming about in restricting their use and pushing back when they can be used and can't be used. So hope that kind of clears a little bit up. Again, we're not really, trying to push an opinion one way or the other. We're just about trying to give you guys the facts so that you can make informed decisions yourselves. I am Doc for Thorofan. Again, hope everybody has a happy Hanukkah, Merry Christmas, and a wonderful holiday season. And as we close out this 2019 and move our way into the new decade of 2020, remember that the only place to find the most accurate and non-biased information when it comes to the thoroughbred horse racing industry is right here at Thorofan.